starting over there, is John Engelmann. John, how are you? You are a male nurse, right?
I am.
With the OB department.
Yes, I'm the director of the OB department and a few other departments as well.
Okay. Next to John is Roxanne Ackroyd, who's an RN.
Okay.
And then Bobbie Nordquist is an RN as well.
Okay.
So all three of you work together as a team? Is that how this works?
Yes.
Mm-hmm.
Okay. Okay. You know, it's kind of neat. Can I ask you one question that's not on my list here? We do not have this service here in Conneaut anymore. That's gone away. When I talked to a lady the other day that we were going to be having you guys on, gals, I was asked if I would ask this question. Before I forget to ask it, I'm going to do it right now. When a lady becomes pregnant, do they have to go to a certain doctor in your hospital to be taken care of? Because that's the doctor that's going to be delivering the baby. Is that how it works? The general practitioner doesn't?
Yeah, you'd have to go to an obstetrician, and there's 3 employed by ACMC.
Okay, okay. Big service here in the county. All right. That being said, John, how many deliveries did ACMC have last year?
In 2012, we did 450, and the year prior to that, we did 500. So,
really?
There's been a decrease with the economy. I think people have been holding off a little while, and you know, it's a trend that we're seeing throughout Ohio as well as northeastern Ohio.
Okay. And how many doctors deliver the babies there?
Well, we have the 3, Dr. Lazarescu, Dr. Thompson, and Dr. Sushada.
Okay. Okay. You know, actually, I think this is the first time we've had anybody from your department on this show.
Well, Dr. Thompson was here a few weeks ago, I believe.
She was. It was a she, right?
Yes. Yeah.
Yes, she was. Okay. I guess I didn't put 2 and 2 together on that.
She's been with us for about a little under 6 months now.
New.
Dr. Sushada has been there for almost a year and a half, and Dr. Lazarescu's been there for almost 9 years now.
Really?
Mm-hmm.
Really? Do you deliver high-risk babies?
Not on purpose. Sometimes that will happen, but we are actually a level 1 facility, and with that we're supposed to be doing the low risk, so over 35 weeks gestation, and so once in a while a baby's not going to wait, and so they'll make it to Ashtabula. They can't be transferred out to Cleveland, and so we will end up delivering those babies.
And you know, when we say high risk, I mean, can you explain that?
Well, the longer term that the mom carries the baby, the more developed the lungs are, and the safer the delivery can be.
Okay.
Under 35 weeks, and every week makes a difference. And under 35 weeks, those babies are pretty tiny, and their lungs are not ready to be without maybe ventilation or more assistance. So we can stabilize those babies, but it's for the best that they be transferred out and cared for with other specialties.
Let me ask you girls this: what? Because I'm not familiar with this. My son was born a long time ago, and the times have changed. You know, back then I think my wife was in the hospital for 5 days. They don't do that anymore, do they?
No, 2 days.
2 days.
2 days for a vaginal delivery and 3 days for a C-section.
Is that right?
Time they deliver, right?
Oh my gosh, yeah.
So,
I mean, I go back so far that they didn't even have Lamaze back then. Is that still? They still use that?
yes, we do. I'm a childbirth educator, and we don't call it Lamaze. We call it childbirth education because
that's the new name of it.
Yeah, we use a lot of different things, and we have classes that anybody can come to, even if they need to be pregnant, but even if they're not going to deliver at our hospital. There's a 4-week class. They're every Tuesday night, and then we have it.
How many classes?
4.
Just 4. Just you can do that. God, it seems like when for the second child, it seemed like it was longer than that.
For that, well, we used to have longer classes, and people are very, very busy. So the commitment to the classes was harder and harder because of their busy schedules. So we went to 4-week classes, and they're 2 hours long.
2 hours.
And so we go over relaxation breathing, and we talk about the pregnancy, and then we actually talk about you know, labor and delivery and what the significant other can do to help them. And then we talk about C-sections, and of course epidurals and pain control, and then a little bit about the babies. We do have some of the pediatricians come to our classes and talk with them too. And pretty much we're open to any questions and stuff that people have.
I have to say this, Roxanne, I was a nervous wreck when for the second child that we were attempting to have, and I did not want to go through that Lamaze thing because I didn't want to have to experience it. You know, the first one was bad enough. I was a nervous wreck. Of course, I was young. I was in my teens. But, I mean, the second one, I was afraid of going through that route because I didn't want to experience that. Now, I know that's probably weird, but I did not want to. I was afraid. That's a guy thing, I think.
No, we have guys that come and they watch the videos, and our videos are probably a little bit more graphic than what you get on the baby story. And I've had them almost pass out or look away.
Yeah.
I had one mother who was vomiting in the bathroom during the childbirth videos because she was so nervous about what was going on. But actually the classes are designed to help you have more knowledge so that you feel more relaxed when you're in labor and delivery, and relaxation is the whole entire key to deliver your baby.
Yeah, yeah. Now you don't have to. You're a teacher, so you don't have to be there for that experience when these people go through.
Oh, sure. I have to be there. I work in labor and delivery too. I work full time in labor and delivery on our floor too.
Wow.
Yes, and I do it all. And we also do tours on Monday nights, every other Monday night, to show people around our facility, and it's kind of a mini educational because we talk about different things there too. And they can sign up in their doctor's office for that.
Now, in your position, I mean, are you gals on call then? I mean, you don't know when a baby's going to be coming, you know, so you get called to say, Mrs. So-and-so's having the baby now, and then you get called out. Is that how that works?
Well, we have the hours that we're scheduled to work, and then we have additional hours that we have to be on call also. If there's an emergency and they need extra help, we have to sign up for extra hours too. So yeah, we get called in.
I find this fascinating because I've been out of the loop here for a while, and things have changed. As I mentioned, it's changed completely since 1970 and 75, whenever the situation was. John, can you tell me who can work in the OB department in the hospital?
Sure. We have RNs, we have LPNs, and we have what we call OB techs in our department. And the RNs will work in the labor and delivery. They'll work in the nursery. They will work in the postpartum area, and as well as the OR. So they're pretty versatile. It's a great group of staff. It's a stressful job.
I was going to say it has to be.
Yeah, and they have to be a master of all those areas, so it's quite challenging. And our LPNs work in our postpartum, and our OB techs are they assist the surgeon as well as work throughout the other areas. They assist the surgeon during a C-section if one would need to be done.
So you're a working nurse then, right? I mean, you're right in there with the situation.
I am not
for goodness sake.
I wouldn't consider myself a clinically prepared OB nurse.
You're administrator.
Yeah, I do. I sit behind the desk more often than not.
That's understood. Okay, you got to have one of them. Yeah.
I will help out when I can, but I leave the challenge to the clinical staff.
Yeah, so that's okay. How about tracking quality of your performances?
Well, we seem to track everything under the sun. Every statistic that you can imagine, we do track. But two that we are tracking right now, and it's kind of a statewide, if not national initiative, are the 39 weeks. We want to see moms carry the baby to at least 39 weeks. Like I said earlier, the longer that the mom can carry the baby, the more the lungs are developed, the larger the baby will be. And so it makes good sense to wait at least that 39 weeks. And really proud to say that we've done a great job changing that, and since July of last year, we have not had any babies born less than 39 weeks without an indication. And occasionally, you know, there'll be a reason. Maybe the baby's in distress, so they will have to take the baby early.
Right.
But it's been a change in the culture, because we used to see, and I've been there for 9 years. We used to see a lot of people come in and, I'm tired of being pregnant. You know, it's time.
Mm-hmm.
And if it was appropriate, the doctors would accommodate that. But now we're using this different criteria, and it results in better outcomes and less likely to have a C-section.
Do you find, and this is for all of you, okay, I take it that you girls have been doing this quite a while, right? Or for a while. The fact that, you know, they come out in the last several years to not drink, not smoke, has that helped the situation as far as birth? You know what I mean? I mean, has it made the situation a little bit better or safer or healthier?
Well, now there's other issues we have to deal with, you know, as far as drug use.
Yes.
That's
I understand
the
that.
big thing now.
Is it?
Yeah.
And they still do that when they're pregnant? They don't care.
It's an addiction when they're using drugs, or, you know, cocaine, heroin. Sometimes they start with Percocet and then they go on to heroin. And it definitely, the baby has to go through withdrawals after birth too, so they need to remember that. And
how do you fight that, Roxanne? I mean,
how do you fight it? With education. You know, we try to tell our moms in our classes, and the physicians tell them in the office. We also do drug screening when they come in.
Do you?
Yes, and on the babies too.
Then what do you do though if they are?
That goes to social service, and they take care of it. We try to get them into rehab, the mothers, and if they consent to rehab, their babies can go with them.
Never thought of that.
Yeah, so the drinking's not so much of. We don't want people to drink when, you know, drink alcohol when they're pregnant, but it's not quite as much of a problem because a lot of people are aware of it. A lot of people smoke when they're pregnant, which actually makes for a smaller baby. It leads to more miscarriage, more sudden infant death syndrome, and a lot of problems with the labor. And then you have little babies, but little babies doesn't make your labor easier. And afterwards, then the babies have a lot of problems with asthma, and again, it increases that sudden infant death syndrome, and there's a lot of issues through their lives. So,
say if you have a baby that is going through withdrawals, how do you combat that? I mean, do you have to put them on special medications, or?
Well, we actually are just developing a program right now because drug use is becoming more and more prevalent. So what we'll do is, usually they're about 2 days old, 2 to 3 days old when they start really going through it. And they will cry constantly and shake, and you can't comfort them.
Man.
And so we have a scoring measure that we use that will say, this is what this baby's doing, and then we score it. And if they're too high, then we have to transfer them to another facility in order for them to receive medication to help them go through withdrawal, so that then they can then go home.
That is so terrible.
So, yeah.
Sad, actually.
It's very sad.
Yeah.
So that in itself is a reason not to do drugs while you're pregnant.
Yeah, yeah. And I'm from the 60s, so, you know, we had a lot of that stuff going on even then, you know, and it sounds like to me it's even getting worse all these years later. We kind of mentioned this, but I'd like to go over it again if we haven't touched on everything. OB education classes. You mentioned that earlier, that you have classes for delivery and that sort of stuff.
We have the 4-week classes. We also have a class that just focuses on labor and delivery itself. That's 2 different nights. They're actually 2.5 to 3 hour classes, which is a long time to sit through, but if you don't have the time to commit to a lot of nights, it works for you. And then we also have infant CPR classes that people can take, which are very important if you're going to be taking care of a newborn. And if you live down south in the county or live in more of a rural area, you want to know how to do that, because the ambulance might not get there as quick as you want them to. So we really like to encourage that too. We also have classes that people can take to learn how to take care of their children, take care of their babies. We have sibling classes, so if you want to bring in, you know, your 7-year-old, your 5-year-old, to kind of get familiar, where is mommy going to have the baby, and what's the baby going to do, and what's the baby going to look like, that kind of stuff. We have those kind of classes too.
You know, when you send them home that soon, you know, after the delivery, are they really prepared to be moms?
I think that they are bombarded with so much information because they've just gone through labor, which might be 14 hours of labor.
Yikes.
And they're tired, and then they're trying to heal, and then everybody comes to visit them, and they're trying to perhaps breastfeed the baby for the first time. You know, they've never breastfed before, and then they're learning how to change the diapers and what's normal for their baby and filling out all the paperwork. And then we have them watch a video at the hospital about how to care for their baby, and then, you know, then they go home. We go over stuff with them too. So what we do is we say, if you have any questions, you call us at ACMC, and they'll put you through to our floor and just ask us what questions you need to know. Because sometimes you don't think of the questions, or you don't realize you don't know something until you get home. So we're always open 24/7, and we're open to any questions. If we don't know the answers, we're going to call somebody or call the physician and have them call them. So you don't have to feel like you're out there by yourself. You can
That's
call.
reassuring. That would be helpful, very helpful.
We do give them quite a bit of education during that 2 to 3 days. It's around the clock. The nurses, I'll come in the morning, and they will have work with them for a couple hours in the middle of the night. We'll do whatever it takes, whenever it takes, to get them as prepared as possible.
Good, good. You mentioned 14 hours of labor. That's probably cringing a lot of ladies out there, but that's a long time. What do you do for pain?
We do have IV pain medication that we can give them,
Okay.
and we do of course have epidurals. But before you get the epidural, you have to be in active labor, and you have to be dilated so many centimeters before you can get the epidural. So we do offer IV pain medication before you get to that point. And the epidurals, some people think with the epidural they're going to be completely pain-free, and a lot of times, you know, they do still feel some pain because it just blocks the pain receptors to the brain, so you are still going to feel some things.
Right.
So people have this notion that they're going to feel nothing. And a lot of times when it comes to the end, when it's time to push, we often turn the epidurals off anyways, because we want them to feel some pain so that they can push. But the epidurals, you know, most of the times they work. Sometimes they are going to feel still some pain.
Yeah.
So.
If they can't push, you know, if they feel that they don't feel that pain when they're going to push, then sometimes that leads to using other things to get the baby out, or it can lead to a C-section if they can't push effectively. So that's the reason. We're not trying to make them just feel pain. You know, I mean, there is a reason to, let that wear off a little bit, because they push much more effectively, and they can get the baby out faster. Plus, we don't have to use other things to help the baby come out.
I always tell this story whenever I talk about pregnancies. I've always said this. I always thought I was a wonder baby because I was born on my dad's birthday, and it was like I was 16 or 17 when I found out I was a cesarean baby, that I thought it was a miracle, and it wasn't. But my dad always said, we actually had you 2 weeks before you were due, and that's why you're crazy. You know? But I guess I was born 2 or 3 weeks before because they wanted to have it on his birthday. I don't know what that was back in the late 40s, but that was the big thing. Another question. Breastfeeding. Moms out there. Do you support that?
I support it completely, but these guys can tell you more about that.
Okay.
Well, the Surgeon
Are you
General,
both moms?
Yes.
Okay.
The Surgeon General of the United States, you know, recommends breastfeeding. That's the very best thing that you can give your baby, the very best thing you can do for your baby. So we highly support it.
Okay.
We have a lactation consultant that can come in and see our moms and help them with the breastfeeding. But we also, a lot of us are moms. We have breastfed, or the ones that aren't moms, you know a lot about it. And we'll stay in the room and help them work with it and everything. And we do have breastfeeding classes as well.
You do?
As well as if they're on WIC, there's a breastfeeding program. WIC is very strongly supportive of breastfeeding. So that's a really good resource for them to use if they're if they're eligible for WIC and stuff. But breastfeeding is very natural, and it is the right thing to do for your baby.
And
the studies are endless as to all the benefits, and they just keep coming out with more. So.
And you know, it is a natural thing, and unfortunately, the news has made it into a disaster. You know, they've made controversy out of this thing, and I think it's so wrong. You know, that they've gone that route. You know, it really bothers me a lot.
Well, let me just say that this is my thing that I tell people. Breasts were not made for Victoria's Secret. Breasts were made for breastfeeding, and that's what we should use them for. Sure, you know, 5 years old breastfeeding, we're a very developed country, that's probably not necessary. In underdeveloped countries, they need to breastfeed sometimes longer because they don't have good food for their children.
Yeah, exactly.
But we would, you know, like them to breastfeed a year to give them a good start. And moms, it's good for the moms too because you get back into shape faster, plus you can eat more calories. So it's a win-win situation.
So, Roxanne, so the 1 year is normal for breastfeeding?
Well, it's encouraged. That doesn't mean that it happens that way, but anytime they can breastfeed, even if it's for 2 months, it's better for the baby. There's all, like John said, there's all sorts of studies out there. It's better for them for learning, digestion. Oh my goodness, if you have allergies in your family, you want to breastfeed your baby because that decreases the allergies that are out there. And it's very cost effective too because,
really?
Yeah, you know, you don't have to pay anything for breast milk.
That's true.
So
yeah, that's true.
It's a way to save money as well. And moms do get back into shape faster. And
why is that, to get back into shape?
Because it's a natural, when you breastfeed, your uterus, which held the baby, is going back, it's going through something called involution where it shrinks back down to normal size. And as you breastfeed, your body releases oxytocin, which causes that uterus to cramp to go back down to normal size. That's a natural way. It also helps to decrease bleeding in the mothers after they deliver.
Really?
So, and you need 500 calories more a day when you're breastfeeding than just normal. In the end of pregnancy, you need 350 calories more a day than normal. But with breastfeeding, you need 500 calories more a day.
With breastfeeding, would that help the weight loss too?
Yes, it
It
helps
would.
the weight loss. In fact, with both of my children, after I breastfed them, and I actually went down to a lower weight than before I was pregnant.
Really?
Because it helps you burn off the calories and stuff. You're using a lot of your calories for making the breast milk and for the breastfeeding itself.
Okay, interesting.
So it's a very natural way to do it.
I gotta ask you this: what's skin to skin? I have no clue what that is.
Okay. Skin to skin is after birth. We would like the babies to be against mom's chest, skin to skin. What we do is put a diaper on the baby. The baby has a diaper on and a little hat, and then mom, it doesn't have a bra on or anything. She's just skin, and the baby goes against the mom. We can cover them with a blanket, so it's very, you know,
Right.
it's not showing off a lot of stuff or anything. And what skin to skin does, it promotes bonding with your child. It also promotes breastfeeding. It makes breastfeeding more successful because they're right there. And it also warms the baby to the correct temperature. Babies need to warm up after they're born. They come out into this cold environment, you know, and they get cool. We put them back on mom's chest, and it's a natural way to warm them. And moms can warm them up to the right temperature. Totally. Neat thing about skin to skin is if they do it sometimes in NICUs and stuff in big hospitals for little babies, and they might put it against dad, you know, to warm the baby because maybe mom can't or something, and we can do that too. We've had dads do skin to skin too, but you have to watch them when dads do skin to skin because the dads can overheat the babies.
Really?
They don't have that temperature control like the mothers do. So it's a really great way to bond. It increases breastfeeding success. And it also warms the baby to the temperature that needs to be naturally.
This might sound crazy to you, but I have this kitten at home. Well, it's a cat, a little boy now. He's a year old, and he was raised by humans because he was dumped the day he was born, and they saved him. They bottle fed him and everything. And what they did is they put the kitten on the lady's chest. That cat still does that to this day. That's the bonding. That even in an animal considers the woman being the mother, you know, like a mother to him, and it's amazing. And somebody told me that was just a natural thing for babies, even animal babies, to do that, you know. So that I never heard that before. So
they can hear their mother's heartbeat too,
yeah.
and they in utero, of course, they hear mommy's heartbeat all the time. So they like that too. It's very, very comforting to them. So it's a really neat experience.
Man, I'm learning all kinds of things here today. We did mention the stay after delivery. was it 1 or 2 days after, or is it 3 days?
It's 2 days for vaginal delivery,
Okay.
3 for C-section.
3 for C. Gosh, I can't believe that.
Yeah.
That is amazing. And they can go home and they can actually move around and everything, even though they have an incision.
Mm-hmm.
Wow.
They get up the first day. Within 24 hours, they're up,
So you didn't do
walking
that
in their
before.
room and taking showers. And they might need a little more assistance at home. after
We do
that.
offer a celebration dinner also.
What?
It's called a celebration
Yeah.
dinner that they can have the next day after they deliver.
Really?
They have a choice of 6 different entrees. The patient and the significant other can choose what
That's
they
kinda
want
neat.
for their dinner.
It's very nice.
Yeah. Yeah.
Good food too.
Is it?
Well, it looks really
It looks
good.
good.
You never had a chance to try it.
No, not yet.
How many people could be in a room for delivery?
Well, we try to keep it down to 2.
2.
Because if a baby turns bad, the rooms can get small very fast. Because we'll need respiratory in there, and we'll need extra staff in there. So we recommend that only 2 people are in there for the delivery.
How do you handle that when it goes bad?
Well, we're all trained. We're all Code Pink trained, so we can handle a bad baby. All of us. You have to be Code Pink certified. And like I said, we have respiratory there. A lot of times, if we need the pediatrician there, we will call them ahead of time. If we know the situation is going to be bad, we'll call the pediatrician and have them there on hand too to help.
That would be so upsetting to me that to have to do that. But you, like you say, you're professionals. You're trained. You know what you got to do.
And we stabilize them until they can be transferred out if they need to be transferred out. Sometimes they might need just a little extra oxygen for a few hours, and then they can go back to their mom. But we are all trained to handle a bad baby.
Roxanne, you mentioned the 14-hour labor. How long is an average labor?
It's about 14 hours.
Is it really?
Sometimes 16. If they're induced, now this is like from, the beginning of early labor where you're starting to have contractions and, they might be 20 minutes apart and then they start increasing and being closer together.
Do you get a lot of false alarms where they think they're going to?
We do. We get people that have maybe contractions every 5 minutes and they really are uncomfortable for them, a really bad backache, maybe for a couple hours, so they come in. And we're okay with checking them. We just wanted to know that if you're not in good labor, you will be going home. So, but it happens, but we don't mind. That's where we're there for that. But really, they should wait until, if they have a low-risk pregnancy, no problems, and if their water's not broke, then they can wait until the contractions are every 5 minutes and they can't walk through them and they can't talk through them. They need to come to the hospital. If their water breaks, they need to come to the hospital now. Yes.
So 5 minutes is when you say, all right, Mom, I think we better get to the hospital.
Unless it's their 10th baby or something and it's a snowstorm. You have to always consider the weather conditions and how far away you live from the hospital.
Yeah. Well, there's a lot of different things you gotta remember out there. I'm glad I was really young when I had my son. What about is it less time for labor if induction of labor is put into the process?
It is a little bit shorter. Sometimes they'll come at about 6 o'clock in the morning, and if they're well dilated, opened up and stuff, they'll come in at 6 o'clock in the morning and they'll induce him and they might deliver at 2 o'clock in the afternoon. However, sometimes they're induced by a different method, and that's a cervidil, which is a vaginal suppository that's inserted into up by the cervix, which is the opening to the uterus. And they put it up there and they have to be there for 12 hours with that. But they can rest and sleep and talk with family and stuff. And then they actually have Pitocin then the next morning. So that makes for a longer labor because, they're 12 hours just with the cervidil, which actually is to thin the cervix. And then they might deliver again, like maybe at 4 o'clock in the afternoon, sometimes noon, 4 o'clock in the afternoon that next day. So it's longer that way. But if their body's ready, usually it's shorter with induction. Although usually it's a little bit harder labor because we make them have contractions right away. And it does increase your risk of using epidurals and pain medication and C-section.
It really has to be has to take a toll on the body of the lady, because it's got to wear them out, you know. I had some other questions real quick I wanted to ask you. You mentioned that people out there that are interested can tour the hospital or tour the labor area. Is that true?
Right.
On Monday?
Every other Monday night. And
Okay.
actually, if they're going to one of our physicians, they can sign up in the office there, and it's free. And they can come in, they sign up, and it's at 6 o'clock in the evenings, and then we go through the whole entire department, and we talk about labor and delivery a little bit too, and any questions that they have. It's about 45 minutes to an hour long.
It's such a great way to decrease the stress level, because you'll be familiar with some of the staff. You're going to be familiar with the environment. They cover so many different things that it's just, you know, it's the time to learn is not when you're in the middle of pain and
Right.
trying to deliver a baby.
And I can see from just talking to you here the last 40 minutes or so that all three of you have the compassion to want to make sure this is a good experience for the moms out there and the fathers. You know, I mean, it's a traumatic time going through, especially the first one. You know, that's which all of us have done here. But as far as your staff there, now there's a total of how many? I mean, do you know how many years of experience you have there?
I think I added this up. I think with the RNs we have over 200 years of experience.
No kidding.
Yeah, it's quite a bit. We have staff that have been there for 30 plus years.
Is that right?
Yeah, a couple. So it's a very seasoned staff.
Yeah.
Very special group of people. It's
Yeah.
just it's not a type of nursing that everybody can go into.
Absolutely, absolutely. Rox, how long have you worked there?
21 years.
No kidding.
13.
13 years. Wow.
We work together as a team. That's one reason
That's
why
important.
I want to, you know, I like working with the people that I work with, and if we do have a bad baby or we have something happening very quickly, we can count on each other, and we do count on each other.
Sure.
And it's a great experience. It's a little bit different than it might be at a big hospital because they have their different areas they work. We work everywhere. You might see us for your labor experience, and then we're in the nursery doing some testing on the baby or something, and then we're doing your teaching before you go home. So you see us in all different capacities.
I'll tell you what, guys, I really learned a lot today. I was kind of, like I mentioned earlier, I was out of the loop because it's been so long since I've had my son, but it's amazing how things have changed, how times have changed, technologies have changed, and I really appreciate you coming in. I wish you would come back again down the road soon, and I'm sure there's things we didn't touch on that we could touch on again. And I'm sure a lot of people out there. We did not take phone calls this morning, but maybe the next time we can. We'll see what happens with that. But
Well, we'd love to come back, and we'd also like to invite you to come to one of our tours. And just as a special guest, you don't have to have a pregnant significant other.
thank the Lord. Too old for that now. But yeah, I would like to see the operation. I really would, because it's been a long time, you know, since I went through that. So thank you so much, John, Roxanne, and sorry, Bobbie. I should remember that. The girlfriend's name is Bobbie. I want to thank you so much for coming in, and I learned a lot. I'm sure our viewers and listeners